Hi everyone, welcome back to my channel. My name is Nadisha, aka Natural Nurse. On my channel, I focus on personal and professional growth and development and also nurse entrepreneurship. If that's something that you're interested in, please hit the subscribe button. And if you like the content, feel free to give a thumbs up. So in my last video, how I make six figures as a nurse working from home, I briefly introduced myself, spoke of my nursing background, and also spoke briefly of my current role as a documentation nurse. And I did receive a lot of questions asking, what exactly is a documentation nurse? People asking, what does a documentation nurse do? So this video, I'm going to go into more detail as to exactly what is the role of a documentation nurse. The documentation nurse reviews the patient's chart in its entirety from admission to discharge, and the purpose is to accurately reflect the patient's severity of illness. And all treatments are reviewed, all procedures, all medications, labs, images, everything that's done for the patient has to be reviewed in order to get a clear understanding, a clear picture of exactly what is going on with that patient. The goal is so hospitals can adequately be reimbursed for the services provided for each patient. So for example, a patient comes in with shortness of breath. They're saying to the physician that for the past 3 nights they've had to sleep in their recliner because whenever they lay flat, they become short of breath. Or they're usually able to walk 3 blocks before becoming tired, but they can only walk half a block before becoming winded. Physician writes that the patient is being admitted for heart failure. Echo is ordered, they're given stat doses of Lasix, and a cardiology consult is requested for this patient. Cardiologist sees the patient and says the patient has acute heart failure. I'm waiting for the results of the echo. The results of the echo comes back and says the patient's EF is 25%. So I'm already thinking in my head and I'm just waiting. I'm waiting for additional documentation to be documented on this patient, and the doctors aren't writing it. So I have to get in contact with one of these physicians so they can further specify the type of heart failure that the patient has. Based on the echo, I know that as a documentation nurse and clinically, the EF of 25% indicates systolic heart failure. So that has to be written. The doctor writing acute heart failure is just not enough. They have to further specify, is this a diastolic or is this a systolic heart failure? So the appropriate documentation would be acute on chronic systolic heart failure. And once a physician writes that, I'm happy. He's happy because I don't need to bother him anymore and all is good. But acute on chronic systolic heart failure makes a whole lot of different than just writing heart failure in the chart. It makes a difference with treatment modality that they give, because obviously they need to give more Lasix. They needed to do all these extra things. Probably they're monitoring, not probably, I know for a fact they're monitoring eyes and nose, and also the reimbursement is very, very different for an acute case versus a chronic condition. So that's just a brief example of why our role is so important and exactly what we look for. The documentation nurse also starts coding the chart while the patient is in-house. So we have to be familiar with the coding guidelines. You must know the coding guidelines. You don't have to have all of them memorized because there's just so many of them, but you must be familiar with the coding guidelines. That's the basis of what we use to code the patient's chart. But we're not coders, so the coders are the ones who finalize the chart, but the coding starts while the patient is in-house, again, to further prevent insurance denials. That's just the bottom line. Hospitals need money. Another important role of the documentation nurse is education for other nurses, education for other staff who don't know who we are, and also education for the physicians and for the providers. Because like how you and I didn't know what a documentation nurse was or is, a lot of physicians, they don't know either. And honestly, they don't want to know who you are. They don't want you coming out of the woodworks, calling them, popping up on the unit, asking them, Doc, can you further clarify this diagnosis that you wrote, or Doc, you did not write this. I mean, we don't approach them in such a way because they don't want us telling them what to do. But at the end of the day, if the documentation is not in the chart, the hospital will not be reimbursed. So that's our role, and we have to communicate that with them in a respectful way in order to gain their respect. We have to be comfortable with having clinical conversations with the physician. You have to be comfortable with that, because once some of these physicians, they sense that you're not confident in what you're saying, they will just disregard you, completely disregard you. So in order to gain their respect and to let them know that you know what you're talking about, doc, I need you to do this. And most often they're compliant. Once they see that you know what you're talking about, you know your stuff, they will comply with whatever you're asking. And if they don't, you just escalate it to your superiors or their superiors, because at the end of the day, the hospitals don't get paid, they won't be getting paid. Another important function of the documentation nurse is most often you're required to give presentations. That could be presentations to your colleagues, because education is so important to this particular role, because things are always changing and you have to be willing to change. Like I said, those coding guidelines, annually they change. You have to be on top of the changes. So sometimes you're asked to give presentations to your colleagues or to other nurses or to the providers as well. And what are the degree requirements for a documentation nurse? I get asked, do you have to have a master's for this role? Because a lot of job descriptions do ask for a master's, but that is not a requirement. That's not something that you have to have. It's nice if you have a master's. It's preferred if you have a master's, but if you don't be discouraged. If this is something that seems of interest to you, definitely pursue it, because a lot of documentation nurses do not have master's degree. I've worked with documentation nurses who only have an associate's degree. So again, if this or another position is of interest to you, but you're a little deterred because, oh, I don't have that degree that they're asking for, or I don't have that certification that they're asking for, apply anyway. You never know what may happen. You absolutely never know what may happen. Like I said, I was just applying for positions I know I didn't qualify for, and I did get called. That's how I found out about this particular role. I applied for one thing and I got a call for this position, and that door of opportunity opened itself for me. Critical care experience is something that you must have for this particular role. A lot of facilities, if not most facilities, prefer nurses with critical care experience, at least 3 to 5 years of critical care experience. ICU nurses just tend to have a much stronger clinical background because of the patient populations that they deal with, the acuity of illnesses that ICU nurse sees, and also the procedures that are most often done in the ICU. A ICU nurse is going to know why they're doing certain things for a patient, because that's the procedures that they see. And most often those ICU nurses know how to do certain procedures versus a nurse in a different area. And what is the work schedule for a documentation nurse? Most documentation nurses work Monday to Friday, 9 to 5 or 7 to 4, an 8-hour shift pretty much. Once you leave the bedside, that 12-hour shift, it is just no more. And to this day, I still miss a 12-hour shift. If I was supposed to do this and have 12 hours, oh my gosh, I would be in, that would be the ideal situation, but you just never get everything. That's just life. There's always some kind of trade-off. You just don't get everything. But 12-hour shifts, that's usually just for the bedside. The flexibility that offers, if you like having your stretch of days off for another job or to travel or whatever, that's just no more once you really leave the bedside. And sometimes that's why people stay at the bedside, is because of that flexibility. Some people do work weekends. That's a requirement, is that they work some weekends and they have a day off during the week. But from what I've seen, most often the standard is Monday to Friday, whether it's 7:30 to 4 or 8 to 4 or whatever the time schedule is. But some programs do allow you to start earlier and finish earlier. It all depends on the manager and management and style. They don't care when you start. As long as you start the work and as long as you complete your work within 8 hours, they're okay with that. But there is a lot of flexibility in this area, and that's another reason why I love it. A lot of documentation nurses do work remotely. I'm currently 100% remote. Some programs, they have 100% remote programs, meaning that the documentation staff does not come on site. They have remote staff meetings, they have remote educational sessions, and if they need to contact the physicians, that's done via email, texting the physicians, and having a phone call with the physicians. Some programs do have a hybrid program, and what that is, some days nurses are on site, and the other days they work from home. And the days that they're on site may be the days for education, the days that they speak with the physicians and educating the physicians, or the days that, whatever they need to do on site, that's done on those days. And then there are travel CDIs. Travel CDIs are CDIs that they, like travel nursing, for a specific period of time or the time that's agreed in their contract, they travel to a facility and they work at that facility for that time period. And then the final question is, how much do documentation nurses make? So in my research, I went online and I did see an average salary of about $73,000 to $76,000 for the salary of a documentation nurse. When I started 5 years ago, I started at $90,000. And a few years later, when people came on board, they were at about $95,000. But currently, I work as a consultant. I work as a documentation nurse consultant. So I'm not directly hired by a facility. It would be equivalent to a per diem nurse or a travel nurse, contracted nurse. So for that reason, I get paid a little bit more because I'm not getting health benefits from that hospital. I'm not getting 401k benefits from that hospital. So they're able to pay contractors a little bit more money because they're not investing those other financial resources into a contractor. And I'm 100% remote. So I could work with different hospitals regardless of where they're located because everything is done remotely. And then experience for a consultant is very different from an entry-level documentation nurse. You need at least, for some facilities, I believe it's at least 3 years to about 5 years of documentation improvement experience before you can work as a consultant, or you need to be certified as a documentation specialist as well before being able to work as a consultant. Because as a consultant, you're supposed to be an expert pretty much. So you work independently. There's no one to call. There's no one overseeing you, telling you what to do or anything like that. Obviously, if you need clarification or anything like that, you can consult your manager to ask a question, but you're expected to know your stuff as a consultant. So that's another reason why they invest in you, because you're bringing a certain level of expertise. So yes, that's the role of a documentation nurse in brief. I'm hoping someone found value in this content. And if this is something that's of interest to you, definitely pursue it, because they are always positions available for documentation nurses. So again, if this is something that you're interested in, definitely pursue it. And if you like the content, give a thumbs up. Leave in the comment section. Let me know, what type of nursing do you all do? What type of nursing, especially if it's non-bedside nursing? I'm curious as to the different areas in nursing that some of you guys do, because there's just so much out there. There's just really so much in nursing that's out there. I'm curious. So let's have a conversation down below. Hit the like button if you like this content.